Honestly, I was an idiot. Straight up. I know when I'm wrong. I didn't take this virus seriously. I didn't take my own health seriously.
Dude.
Jimmy Flores has a warning for everyone. Don't be like him. The once healthy 30-year-old from Scottsdale, Arizona is now at home recovering from COVID-19 after spending more than a week in the hospital.
I got 103 fever, I had body chills, I had body sores. I started developing loss of sense of taste and smell.
Flores suspects he contracted the virus after a night out at a bar in early June.
It was a very busy bar. I mean, there was a lot of actions that could have been better, like sharing drinks and whatnot. So there was just a really high risk of getting COVID there.
And now, as he sees the number of cases in his home state explode, he's urging others to be vigilant.
My penance was first going public. I went public because when I was sitting there in my bed thinking that I was possibly going to die, I was looking at my friends on Facebook, still partying, still doing all this other stuff.
35 states across the country are seeing an upward trend in COVID-19 cases.
We are now having 40,000+ new cases a day. I would not be surprised if we go up to 100,000 a day if this does not turn around.
Arizona is one of 8 states to hit record levels this week. Republican Governor Doug Ducey attributes the surge to more testing, but many believe it may be due to Arizona's reopening last month.
We knew as time went on that our numbers would increase. I don't know if we knew they were going to increase this fast.
This is a dangerous virus, and we need to slow it down and contain it.
Yesterday, Ducey announced a number of statewide closures for the next 30 days.
Today's executive order will pause the operation of bars, gyms, movie theaters, water parks, and tubing.
It comes as the number of people hospitalized in the state surpasses 4,700. ICU beds are at nearly 90% capacity.
Has Arizona lost control of the epidemic?
I think Arizona's on the brink of losing control of the epidemic.
Now, fears are mounting of not only the infrastructure crumbling under the weight of COVID-19, but also the healthcare workers themselves.
How close are healthcare workers to a breaking point?
I would say a lot of them are actually at that point or past, frankly. Myself and others are leaving the hospital, sometimes in tears.
The crisis in Arizona is evident here at Manor University Medical Center, where ICU beds are filling up fast.
Patients are dying. There are patients begging me not to put them on the breathing machine because they know they might never talk to their families again. It's really difficult.
Dr. Jennifer O'Hay has worked in the hospital's ICU for 22 years.
How quickly did this evolve?
In the beginning, we were watching New York and we were learning from New York. And then all of a sudden, things just exploded here. I would say that compared to March and April, I'm taking care of at least twice as many patients now as I was then. Now what we're seeing is a lot of our younger population getting sick. 20, 30, 40-year-old patients. They're on ventilators, they're on ECMO.
The upcoming 4th of July weekend has many at this hospital, like Chief Clinical Officer Marjorie Bessel, worried that there will be an additional surge.
If we have another increase like we did after Memorial Day, we are going to become overwhelmed at the hospital level.
As the numbers rise, healthcare professionals stress that the spread of COVID-19 can be mitigated by wearing a mask. At yesterday's press conference, Governor Ducey encouraged residents to do so.
I want to remind Arizonans to please wear a mask.
But he fell short of issuing a statewide mandate.
Do you think that decisions made by Arizona lawmakers cost lives?
I absolutely think that our leadership here in Arizona has cost lives. If people were masking weeks ago, we could have prevented this.
I thought, as soon as the summer hit, that everything was going to be fine.
Some, like Jessica O'Neill, are living proof of how insidious the spread of COVID-19 is, even when you take precautions.
Honestly, until you are sitting here, not being able to see your family, not being able to breathe, being so uncomfortable, you can't truly understand the importance of this virus.
O'Neill says she was being careful, wearing a mask, and still the 30-year-old single mother contracted the virus. She thinks from a single trip to the gym.
And then after the gym, I just did not feel well at all. I was telling my daughter, if I don't feel well, that in the morning I was going to go straight to the ER. And then the coughing started.
With multiple pre-existing health conditions, O'Neill headed to Banner University Medical Center, where she's been for the last 7 days.
I've seen people young, old, it's everybody. It's not picking and choosing. But honestly, it's serious. Like, I don't know how to stress that enough.
Banner Health became so overwhelmed with patients like O'Neill, they called for reinforcements. And nurses like Bridget Harrigan answered.
Today was really busy. We were transferring in and out patients all day. We're just growing by the second, really.
We first met her a week ago.
Today is my first day on the floor on my own.
It's exciting, but it is a little bit scary.
Be putting me in the COVID units the whole time.
I was meant to go to help on the front lines in some way.
She just traveled to Phoenix from Queens, New York, where she spent a month working in the ICU at Elmhurst Hospital.
When I got there, it was like a disaster zone. We were treating it just like you learn as a nurse how you do disaster nursing and triage and everything.
She told us last week she was preparing for Arizona to hit crisis levels.
It's not as bad as New York, but it has every capability of getting there if the cases rise and it overruns a hospital.
Now her concerns are becoming a reality.
How intense is the environment inside here right now?
The staff here, the nurses, the doctors, everyone, I can tell they're nervous and thinking, okay, it's nothing I can't handle. I just came from New York. I dealt with that. But I can see the nurses around me who haven't dealt with that, who look terrified, honestly, and very stressed out.
Tucson emergency physician Dr. Brad Dreyfus fears that if Arizona's leaders don't get a handle on the virus quickly, the healthcare workers themselves will have to decide how to ration care.
We're the ones holding the hands at the bedside. Like, it's devastating.
He says if Arizonans want to help get this under control, there's one thing they can start doing now: mask up.
If you care about America being a world leader, mask up. This is not a partisan issue. Do it for your community.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.